Hello and welcome. My name is Samhita Kumar, and I'm excited to bring you alongside my leadership journey. My project is on integrating mental health and tuberculosis through partnerships, research, and practice. I'll start with telling you a bit more about myself. I have always been interested in the brain, how it works, and how it affects our day-to-day lives. The brain has taken me down a curious and rewarding career path. Across diverse thematic and topical areas, from early learning and memory to the biological basis of schizophrenia, from population mental health and psychiatric epidemiology to the role of mental health in conflict, violence prevention, and livelihood rehabilitation, and more recently, health system strengthening, health equity, and the integration of mental health with TB in local communities. The brain has taken me across diverse domains of the global health industry as well, from research to policy to practice. And it has equipped me with a cross-functional skill set to think about how to take on the global health challenges of today and tomorrow. It has brought me to the place that I am in now, which is the Carter Center, an NGO founded by former US President and First Lady Jimmy and Rosalind Carter, where in the mental health program, we work to elevate behavioral health as a global health priority. To achieve a world where everyone has equitable access to mental health treatment and support, I work to collaborate with country partners to build a behavioral health workforce, strengthen policies and laws that drive mental health service delivery, and reduce stigma and discrimination for a more inclusive social environment. I work to embed behavioral health in relevant health and development priorities, such as TB, and drive research and understanding of what works in program implementation. The latter is a nice complement to my other day job, where I'm a PhD student at Emory-Rollins School of Public Health. As many of you know, TB and poor mental health are each distinct, pressing, and substantial global challenges. But together, they're an even more daunting problem. There is increasing evidence that the global burden of disease for TB unfolds in concert with poor mental health, and that the gendered impacts of both can leave women behind. But data is limited. And while there is recognition of the need to adopt equitable, inclusive, and gender-responsive approaches, there's still limited guidance on what that looks like and how it can happen. So my project for today, tomorrow, and beyond is to build something that addresses poor population mental health and TB, which have distinct, disproportionate impacts on women. I see that the multidisciplinary collaborations and understandings needed to address these challenges are limited, and that a space that can improve that and bring together experts in global mental health, TB, gender, anthropology, and health system strengthening can go far in bridging the disconnects between current research and practice in mental health and TB integration. This platform would improve not only the knowledge of the links between mental health and TB and their gendered impacts, but also help understand attitudes and incentives towards multidisciplinary collaboration across diverse institutions. Lastly, it would help develop a community of practice for interested stakeholders, including individuals with lived experience and people like me who are learning and growing in this space. This has been an incredible journey where as I have put this project into motion, have learned a lot about the enabling and limiting factors that people and stakeholders contend with to be able to connect the dots in this space. Straddling both institutions has been an advantageous, eye-opening experience, but it has also helped me understand that this project may not be as linear as one may have expected it to be. Over the course of the WomenLift project, I've learned a lot about myself, how I work, and what I would like to work on. And some of the things that have come out from the journey and from this project are that I am well positioned to tackle challenges like this, learning from what's familiar and what I've accomplished successfully in the past, and adapting it to what's new in front of me. That I have a ready network to rely on as I expand my mindset for problem solving. How can they help me? And how can I think differently about what collaboration looks like to be able to achieve my goals? This journey has taught me to stay true to my own goals and priorities and needs, and really put forward what I would like to accomplish and how I would like to see the world change as a driving force in my own career. It has taught me the value of patience and how long it takes, and that this isn't a 9-month project, but a career-long project that one has to make room for, and that one has to be patient with and kind of let life happen alongside. Lastly, it has taught me the value of mentorship, allyship, and peer support to keep this going. And I hope that those things are maintained moving forward, and that it can also help another person start their own journey in global health. What I'd like to leave you with is inspiration that I have also experienced, especially at my time at the Carter Center, which is from Mrs. Carter herself. Making change is not easy, but we must always keep in mind what the struggle is about: the right of people to enjoy equal opportunity and equal treatment in all aspects of life, including physical and mental health care. Thank you.